Hi friends. So today we are going to discuss about one very high yielding topic. So these are the topic is hormones which are acting through G protein coupled receptors. So basically the hormones are divided into group 1 and group 2. So the group 1 will be containing the hormones which are intracellular receptors. So that will include the hormones which act through nuclear receptors and through cytoplasmic receptors. The second one is group 2 hormones, that is the hormones which act via G protein coupled receptor, and they have 7 membrane spanning domains. So first one is which acts through cyclic AMP. So cyclic AMP, it is synthesized by adenyl cyclase and the action is mediated by protein kinase A. So this is something very important. It is synthesis is by adenyl cyclase, action is mediated by protein kinase A. So the hormones which act through it are the hypothalamic hormone, which is the CRH, then TSH, FSH, LH, ACTH, and the V2 receptor of vasopressin. Specifically, it's the V2 receptor. And then glucagon, and then somatostatin. So somatostatin, there is a GI action, that is an inhibitory action is going on. Then secretin, and then catecholamines. So it acts on alpha 2, that is GI, so it is again inhibitory, and then beta. Then next one is PTH and calcitonin, and next one is acetylcholine. Again, acetylcholine is GI inhibitory, which is on M2 and M4. Then the second one is through IP3 or DAG pathway. So the action is mediated here by protein kinase C and synthesis is by phospholipase C. So this one, the hormones which act through this pathway are vasoconstrictors like antithrombin 2, substance P, TRH, GnRH, V1 and V3 receptors of vasopressin, specifically V1 and V3. Then oxytocin, cholecystokinin, gastrin, acetylcholine. Here acetylcholine, not the GI, this one is not inhibitory, okay. And next is alpha 1 receptor. So in cyclic AMP it was alpha 2 receptor and it was inhibitory action. Here it is alpha 1 receptor. And the third pathway is through cyclic GMP, which is synthesized by guanyl cyclase. So this is transducin mediated GT, and the hormones which act through this are nitric oxide and ANF. And some important points: the most potent vasoconstrictor is urotensin. Then the another important point is acetylcholine and angiotensin. They cause decrease in cyclic AMP, but their hormonal action is through IP3 or DAG, IP3 DAG pathway. Then next one is tyrosine kinase pathway. So here the second messenger action is by MAP kinase, and the hormones which act through it are insulin. Then others are all growth factors like insulin like growth factor, epidermal growth factor, fibroblast growth factor, and all the TGF alpha. And then the next one is JAK-STAT pathway. So here the second messenger action is through STAT, and the hormones which act are growth hormone, prolactin, erythropoietin, and leptin. So this question was there in INICET May 2023 as well. Leptin was asked, and the pathway was asked in the question. Leptin was the answer. Then the next, so in this JAK-STAT pathway, there is phosphorylation of STAT proteins. Then the next one is serine threonine kinase pathway. So here the second messenger action is through the SMADs, SMADs, and the hormones which act here through this are inhibin, BMP7, activin, and TGF beta. So BMP is bone mineralizing protein. Then another three important points. First one, secretin is synthesized by the S cells and it acts on the pancreatic ductal cell through cyclic AMP. And it causes increase in bicarbonate secretion. Then the next one is cholecystokinin. It is synthesized by eye cells and it acts on acinar cells through IP3-DAG pathway, and its action is increase in release of zymogen granules and potentiating the action of secretin. So acetylcholine also, which acts through IP3-DAG pathway, it also causes the same action, that is increase in the release of zymogen granules and potentiating the action of secretin. So this is a very important topic. Surely a question will be coming from this topic. So I will be coming back again tomorrow with another topic which is very high yielding. Till then, bye. Thanks for watching. Subscribe my channel.